first of all, I want to get the perfect V-shape treatment. So what it does is you get that, V-shape that I want to like lessen the puffiness that I have right now. I want to do that because, first of all, as a medical student, as a future doctor, I present myself to a lot of people. That means I have to have confidence in meeting other people. And, seeing myself pretty all the time or presentable, the least, is very important to me because that's where I get my confidence. So I've been with CSA for about 10 years now. Because I've started getting treatments from Doc Contessa even when I was in high school. And now I'm already a medical student. She's been my idol ever since because I know how popular she is locally and internationally. Like, she's stellar as a doctor and also as a person. She has been my idol and also like my second mom because she has taught me so many medical stuff. And from there, I already know that she's really capable of anything she does, and that's what makes CSA very very stellar as well, because she's the one who's holding it. And it's not only that, but they're also like a family to me. They really take care of the people that they have, so they take care of their patients 100%.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll be doing a treatment for Jam Ponce. We will be working on the V-contour of the face. So, let's all welcome Jam.
Hi guys, I'm Jam Ponce. Nice
There, yeah. So, Jam, for today, what is it that you want to achieve?
Okay, so one of my problems is, my face, because even though I lose weight, my face is still puffy, and I want to achieve that perfect V shape.
Yes. And may I ask, why is it important that now, the generation now, wanted this V-shaped face?
Okay, for me, because I think it stems from your confidence and how you look at yourself. For me, I'm more confident when I see myself as more presentable. As when I see myself in the mirror, it's more aesthetically pleasing for me, and that makes me happier.
Yeah. Okay. So Jam is still young, very young, in your
23 pa.
Okay. So for this generation, it's more of highlighting the beautiful features of the face. So it's not the anti-aging treatment that we're doing or restoration of those younger looking face. So it's enhancement, and it's really emphasizing the beautiful features of our face. So for Jam, since her concern is really, or what she wants to achieve is the V shape or V contour. So when you say V contour, we look at the cheeks. Actually, we also include the temple there. But for Jam, her temple is still full, so no hollowness. So we check on the cheeks, and then we check on the chin, and we also assess for the masseter region or the angle of the jaw here. So for a letter V or an inverted triangle, so you should really have a narrow face, okay? And the cheeks should have a good contour, and the chin should have a good projection. And of course, there should be the right vertical dimension. Looking at the cheeks, I can see that the cheeks are already in the right contour, right shape, okay? Now, you're 23, and you're a medical student. So being a medical student is also stressful. It also has an effect of accelerating the aging process. So if you check on the skin condition, beginning
Stress.
laxity, beginning laxity. So we also want to do a treatment that will induce skin tightening. And I also kind of want to reduce the cheek fats, okay? So to balance it with the chin. Now with the chin, I want to project it to balance it to the cheeks. So making everything proportioned. So it's the rule of proportions, right? So beauty is balance, beauty is proportion, something like that. So what I'm gonna do for Jam today is to have a better cheek contour. Okay, I'm not gonna restore volume for the cheeks. She has good volume. It's more of improving that curve and also balancing the chin with that of the cheek. And we will be doing the so-called masseter relaxation, okay, with our so-called incobotulinum toxin. And then, actually before those injections, I'll be starting doing also the Ultherapy. My goal is to also kind of slim the cheek fats here. Okay? What do you think, Jam?
Very excited, Doc. I've always wanted to do this, especially with you.
Yes, thank you, Jam. And also with our Ultherapy, we wanted to further improve the texture of the skin. Before, we've done already the so-called treatment of like the pore reduction, prevention of acne, sebum control. We've also used the incobotulinum toxin for that. Remember? Yes. I'm checking on your skin. She really had a very good skin care. Okay. So, I'm excited with procedures that we will be doing for Jam, and we'll show those treatments when CSA Medical Aesthetics return. And we're back, so we'll be starting with our Ultherapy for Jam. So let's make a marking. Okay, for our treatment, we'll be focusing on the mid-face region and also a portion of the lower third of the face. And we wanted to somehow improve the contour of the cheeks and also tighten the skin. So for our markings of our Ulthera, we make a line, a horizontal line from the alar groove towards the tragus of the ear. And then, so this is the upper border, and then our lower border will be the jaw line or mandibular line. So from the chin towards the angle of the jaw. And then posteriorly, we have this vertical line here. And then on the medial aspect, so we wanted to protect the marginal mandibular nerve here, a branch of your facial nerve. Yeah, cranial nerve number 7. Okay, we have a Dr. Jam. And then this will be our treatment lines. So for the first one will be this, and then also here. Okay, so I'll be having a treatment line here and a treatment line there, and some lines here also. Okay, for this part of this layer here, I can also add a little bit, okay, because we also do the so-called infraorbital part of the face. We can also do some shots here. So we actually just make a curved line under the eye area, and we can actually extend a bit here, because I wanted to really improve the contour of the cheeks. So we have the superior border of the zygomatic arch here and the lateral orbital rim. So this is the temple region. So I can somehow do a minimal shots here. So same thing on the other side, the left area. So draw a horizontal line to the tragus. And then your inferior line will be this. So our doctor is following our markings. Right, Doctora? She has an idea about this. And then we'll be doing some of the treatment areas there, and then the infraorbital region, we'll just make some markings there, and then the superior border of the zygomatic arch there, and the lateral orbital rim here, and then this is the temple. Okay, so that's for our Ultherapy. Then later on, I'll be doing a so-called, so more of the chin projection for Jam. Okay, so I don't wanna fill this in anymore, the cheek region, because there's already a good volume. So I'll just work on the chin projection. Actually, if you do a rickets line assessment here, So we really need to do anterior projection, and at the same time, with the rule of the 1/3, 2/3 for the lower, the chin part, so we need to increase the vertical dimension. So we'll also be injecting in the inferior area, and for my projection, I'll add on the lateral aspects of our chin. So we'll give that V-shaped face. So we'll just do filler for the chin, and then our masseter, since we wanted to narrow further the face, we can also inject our intrabotulinum toxins here. Okay, so those will be our injection points. Do you have any questions, Jam?
None, Doc.
None. Okay, because we've already discussed this with Jam. Even before doing any of our procedures, we are explaining to them what to expect and what will be the mechanism of actions, what will be the concept behind it, something like that. Okay, so I have my Ulthera device here. I have the 3.0 transducer. So we'll be working on the lower third to the mid-face region. Okay, the goal is again to do skin firming, tightening, lifting, as well as the contouring of the face, specifically the mid-face section of Jam. What is the feeling, Jam?
Nothing.
Okay, nothing. So actually, there's like this tiny pins or invisible pins. Okay, so the delivery of the energy is through the skin layers. So this one is targeting, like if we have a 1.5, it's in the dermis. If we have the 3.0 subcutaneous, if we have the 4.5 mass layer. Okay, all those tissue layers of the face. So my technique is to deliver the energy for the mid-face section. I am trying to reach the subcutaneous fat layer. So actually our face is made of several layers of tissues. That's why whenever we do treatments, when we say we are in the layer 2, layer 3, or layer 4, or layer 5, we know what we're trying to work on. Okay? Is there like a heat sensation?
None.
None. Okay. So Jam actually has a high tolerance to pain, because the others are scared of Ulthera. They have been hearing reports that it's a painful treatment. So Jam could share with you the experience. She could tell you what she feels, or that it is not really painful. Yeah, because we have some patients
Yeah, my friends, doctor,
scared because they thought that it's painful, right?
Yeah, it's not at all.
I do also Ulthera on my face. You know, for my treatment, mine is more of the restoration or anti-aging. So I wanted to prevent the deep nasolabial folds or nasolabial creases or the marionette lines. So I just did mine yesterday, and I used this 3.0 transducer. Okay, it was really a comfortable experience. Before we do this, we actually apply numbing creams. Okay, topical anesthetic cream. We also have the topical anesthetic spray, the pain-free skin coolant. Then I'll proceed to the opposite side. Okay, so we've heard already like the sound from the machine. So simultaneously, we will be doing our chin projection treatment, and then after that, our masseter muscle injection. So for those asking about which kinds of treatments you could combine, so case-to-case basis, we do, for example, Ulthera, toxin injections, and filler injections at the same time if the anatomical regions are different. Like right now, I'm working on mid-face and a portion of the lower face. Later on, I'll be doing chin filler and then the masseter injections here. So it's like different anatomical regions, right? Okay. So again, I am avoiding the marionette line here because I'm using the 3.0. I wanted to avoid the marginal mandibular nerve, okay? So you'll know also that if there's a branch of the facial nerve that was hit. So the patients will inform you, okay, that part, it hurt. Sometimes the bony region, you feel something there. Especially when we're reaching the zygoma region, some people are saying it's like there's a discomfort when you do the one with the bone area. So far so good? Ah, okay, good. So we had a very good numbing for jam. So again, it's comfortable, or should I say a tolerable treatment, okay? So don't be scared about Ultherapy, because it's really it's very tolerable. Plus it's very safe because this device has this visualization whereby you can see the different anatomical layers there. So this is the so-called MFUV, microfocus ultrasound with visualization. Since I've been doing this for like a long period of time already, so I've memorized the anatomy of the face, the branches of the facial nerves, as well as the facial vessels. So I know which region is safe to do the Ulthera shots or lines. Okay, so immediately after this, we can do our chin filler. So later on, I'll be using hyaluronic dermal filler for the chin projection, and then for the masseter, we'll be using the incobotulinum toxin. Okay, so for some other cases, we still do multiple shots depending on the need of the tissues, the anatomical region we're working on. So we'll still clean the area, we'll disinfect because we'll be doing injections right now. You're still good, Jam? So part of the perfect V treatment package is a treatment of our masseter muscle or the chewing muscle. So we wanted to relax it so that the angle of our jaw will become narrower, okay? So I have here my incobotulinum toxin, specifically Xeomin here for the management of the masseter. So before injecting, I'll use my pain-free solution, spray. So this is a very good anesthetic skin coolant. Okay, very cold, right, Jam?
Yes.
So I'll palpate for the masseter here and inject into the muscle and then aspirate and push. So I'll follow the 3-point injection technique. So that's 1, and posteriorly that's 2, and anteriorly that's 3. For our beginners, they can make land markings for this one. So your anterior border will be the anterior line will be this anterior border of the masseter, inferior will be the mandibular line, posterior will be this part, the preauricular region, and the superior line will be from the alar to the tragus. So if you want to make your markings, okay? So I use a 3-point injection technique. Now I'll proceed to the left side. Jam, could you move towards me? Thank you. So same technique, so spray. So my pain freeze will further help in reducing or controlling any pain. Your patients will really appreciate it when you really reduce any pain or discomfort. So this one is like a painless procedure, okay? So I'll palpate for the masseter. There you go. And then intramuscular injection towards the masseter muscle and then push. So it's going to be a 3-point injection technique. So be careful in injecting your toxin. Avoid the risorius muscle there because the risorius is pulling the corner of the mouth when the patient is smiling, okay? Otherwise, it will give them an asymmetrical smile. So I did now the 3-point injection technique using our incobotulinum toxin, specifically my Xeomin here. And the third part of my perfect V contour for Jam will be the chin projection. So same again, okay? So in doing injections, again, always disinfect the skin region, and then your numbing spray, your pain freeze. It actually has an instant numbing effect, okay? So I'll be using my hyaluronic dermal filler, specifically my Belotero Intense here. So my point of injection will be towards the symphysis menti here. So can you disinfect again? Okay, so I'll be directing the needle towards that bony part there, and then I'll aspirate for safety reasons, and push the product. So slow push, slow injection technique. That's very significant, especially when we're using dermal fillers. Okay, we know that filler injections should be in a safe anatomical region and in the safe technique. Otherwise, if it's done incorrectly, it may lead to some problems. So this is a procedure that has to be done by well-trained aesthetic doctors or our aesthetic surgeons. Okay, so I'll also do an anterior projection. My approach, and for a V contour effect, is I'll be working on a bit of the lateral here on the right side. Again, onto the bone, push. So it's like using one syringe of my Belotero Intense for the chin area, and then for the last injection point, a little bit on the left, so you expect a pinpoint bleed there. Okay, this is the last injection point. Other techniques, you can make use of the cannula, and you can do a fanning technique. You can have an entry point on the lateral aspect of the oral commissures. So that's for the cannula method. Okay, I'm almost done. There you go. So we did the Ultherapy for the contour of the cheeks, plus also some skin tightening, and we did masseter muscle injections as well as the chin injections. We'll show the result to Jam when CSA Medical Aesthetics return. And we're back. We'll now show the result to Jam. So Jam, here's our mirror.
Oh
there
my
you
gosh.
go. Yeah.
Wow,
Right.
Doc, it's like instant.
Yes. So we've done the
Amazing.
so-called perfect V treatments. So we did
Wow.
Ultherapy, masseter muscle injection, as well as the chin projection using our Belotero Intense filler. Okay, so what's your comment, Jam?
Doc, amazing.
Yeah.
Like, wow. I'm just speechless at this point. It's so pretty.
Instant, right?
Yes.
Yeah.
And it's not really painful. It's very
Exactly.
tolerable.
Yep.
And I was scared at first, but then Doc assured me. And wow, wow is the only word I could say since a while ago, because I'm just amazed about how instant it is and how pretty.
Yeah.
Like, there's no swelling. I can't see the swelling at all
Yeah.
right now. Like,
No bruising. Yeah.
perfect.
There you go. So I'm looking at Jam right now. If we check the cheek contour, okay, so we wanted to balance it with the chin so you can have that perfect V. So I did more of the Ultherapy to somehow reduce the fat volume there. And then we will narrow the masseter area to make it like a slimmer face. We'll wait for the effect of our intrabotulinum toxin. Usually it's 8 to 15 days before you see the result, but with our product there's a fast onset of action, like usually 3 days.
Wow.
You see effect already. And then the last part we did was the chin elongation and projection, or chin reshaping, to balance it with the entire face. So the rule is making the upper, middle, lower third proportionate and balanced. And it's also important that your injector is a trained aesthetic doctor, trained with all these injections and the procedure of the Ultherapy, because the provider doesn't just give it to anybody. They just go to trained aesthetic doctors or the surgeons. Okay, only those licensed physicians. Okay, beware of those fake or those imitations. So we just want to warn everybody, and also check for seal of authenticity. Plus, every after procedures of our Ultherapy, we give also this certificate that it's an authentic device. Okay, so for today, we've done one of the MASJ treatment packages, specifically the Perfect V. So for the Perfect V, it should be a cheek contour, chin projection, as well as the masseter reduction for that V-shaped contoured face. Okay, so for our treatments, we always do an individualized or personalized type of treatment because we vary in our face anatomy and we also vary in what we want or what we desire. And of course, there's also variation in the age. So for some, it's for the younger generation, and we even have the older generation where these kinds of people, they just want restoration of their youthful look. But for Jam, it's more of giving an emphasis or enhancing the beautiful parts of the face. So there you go. So instant result, very safe, and it's a quick procedure. Okay, we've done it only in like so even less than an hour, and with the help of our pain freeze, there's a faster numbing effect. Okay, so thank you so much. Thank you, Jam.
Thank you so much, Papa.
Yeah.
As always.
So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. By the way, if they want to follow you or like ask specifically about the treatment, you can reach Jam at?
On Instagram, it's at jamgponce, or you can reach me at TikTok at jamponce with 3 E's.
Okay, thank you so much, Jam. So our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Jam also had another video in the past where we did the skin improvements with our incobotulinum toxin. You can see that at our YouTube channel, Contessa Salvador. And thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.